If you've been double dosed for more than 6 months, as of today, you're eligible for a booster shot. It's important because 5 to 6 months after receiving our second dose, the protections given by both the Pfizer and AstraZeneca vaccines begin to wane.
It adds additional protection, and that helps limit the risk of getting the disease, of passing on the disease, and most importantly, of people becoming very ill, needing hospitalisation or potentially losing their lives.
In Israel, which was the first country to offer boosters, the extra dose of Pfizer has been shown to top protection against hospitalisation back up to 93% and 92% against severe disease.
At the 6-month mark, when we know we might start seeing more people getting both infection and potentially severe disease from waning immunity, then it's important to have that boost.
Today also marks the first day that pharmacies will offer Pfizer. It's hoped this will fast-track the booster rollout. But it's been reported fewer than 1 in 5 pharmacies have ordered any doses.
We are worried that as we wind back those state and territory vaccination clinics where a lot of Aussies chose to get their vaccines, that there won't be enough pharmacies or general practices to be able to pick up the slack.
The low uptake could be because Pfizer is more complex to store and administer.
They can't make it stack up, the amount of staff that they have to put on, pharmacists and pharmacy assistants, the amount of stock that they have to have stored in their vaccine fridges, the amount of consumables that they have to have. They just are losing money every time they do it.
As the double dose rate for over 16s passes 80.5%, COVID infections in under 10s have tripled. And with hundreds of school closures and further disruptions, the rollout to kids aged 5 to 11 is in sharp focus.
We want to make that vaccine available, and we'll be able to do that as soon as the medical regulators approve it, if they approve it.
So after a troubled early rollout, could Australia be on track to become one of the most vaccinated places on earth?
To talk more about vaccines and boosters, we're catching up with infectious diseases expert Dr. Nick Coatsworth. Nick, let's come to the question of kids. How important is it that people under 10 are vaccinated?
Waleed, we really don't know the answer to that. That's the honest truth. I mean, of course, it is under emergency use authorisation to vaccinate children between 5 and 11 in the United States. It's a very different situation over there, of course, where a lot of their adults have not got vaccinated. So what we have to do is weigh up the risks and the benefits. This is a group that gets very mild disease, doesn't transmit as readily, but if it is going to control community spread in our Australian community to have them vaccinated and it's safe, then it is something we should consider.
Nick, we just heard infections in under 10s have tripled, and they're now the largest cases, the group in Victoria. 39 kids in ICU during this particular wave. So low risk is not necessarily no risk for kids.
Well, that's true, Virginia, but it's as though people think that paediatric ICUs have been empty just waiting for COVID. It's not the case. They're obviously busy all the time and often because of infectious diseases. And when we say tripling, they're tripling off a low base. And as you say, in Melbourne, there are kids going to ICU, but they're coming out. They're getting the care that they need. So we don't want to overstate the risks, but equally, if the benefits outweigh the risks of giving vaccines, we should go ahead and do it.
Doc, our vaccination rates keep going up and up. If we hit a level of, say, 90%, 95% of our population above 5 years old, is herd immunity back on the table?
Well, look, things do change, and I mean, wouldn't it be lovely if it was back on the table? I don't necessarily think personally that it will be. You're going to have a lot of international travel. You're going to have this disease around the world, and really we might get to 95%, but, the developing world's sitting at, 10 to 20% or perhaps even less. So we're going to have COVID-19 around for a long time. I think the more we can vaccinate our community, the better. We need to look around the world as well at how that's going.
Can we talk about booster shots for a second? So the booster shot is Pfizer. So even if you had Astra or Pfizer, you get Pfizer. But given Astra and Pfizer different types of vaccine, how does it work that Pfizer's then used as the booster for both?
Yeah, it's a really good question, and I don't think there's a great answer for it. I mean, there is some evidence that if you had Astra and then you get Pfizer, the mixing and matching of the vaccines might give you a little bit more immunity, but it probably doesn't mean that much. I do think there might be a reputational component to it. Now that we've got supply of the mRNA vaccines, people may feel more comfortable getting that as a booster. But keep in mind that if you have had a problem with an mRNA vaccine, then you could equally get the Astra vaccine as your booster and you'd be absolutely fine.
And should we make the third shot mandatory? I mean, you're fully vaccinated in this country if you have 2 shots. Should we just consider the third shot is full vaccination for Australia?
It's a really good question. I think that's another thing that ATAGI will be looking at. And we know that there's evidence of waning immunity. Happily, your immunity from severe disease and death doesn't wane as quickly as the immunity from catching it and transmitting it. But certainly because we have that evidence, then potentially we do need to look at this as a 3 vaccine course, like many vaccines that we have out there.
Always a pleasure, Dr. Nick. Thanks for your time.
Thank you.